Hi everyone, quick chest x-ray case today. 65-year-old female patient with several weeks of cough and new onset shortness of breath. And as we look at this radiograph, we can see that there is increased opacification within the left upper zone. This opacification is really quite diffuse. You can really appreciate it here in between the rib spaces. And when we compare it to the same rib space on the patient's right-hand side, we can see that there is loss of all these nice normal lung markings that we usually would see. So as mentioned, this is very diffuse opacification. We can see it's probably at its most intense towards the hilum and within the left upper zone, and then it fades away as we get to the left middle zone and the left lower zone. A couple of other signs to look at here. There's a little bit of lucency within the region of opacification that outlines the aortic knuckle here, so the thoracic aortic knuckle. And then we might argue that there is just a little bit of crowding of the ribs over here, so a slight reduction in the rib spaces, particularly if we look out laterally when we compare it to the contralateral side. Putting these findings together, I would be worried about the left upper lobe collapse in this patient. And then looking at the rest of the patient, I can't see any pleural effusion, there's no pneumothorax, and there's no aggressive bone lesion here. I can't see an obvious mediastinal mass on this chest x-ray, but of course something could be hiding in there. So let's write a report. Let's say we're doing a chest x-ray here. Recommend CT for further assessment. Okay, let's see what we've got. Evidence of left upper lip collapse, range of lungs, pleural space clear, cardiac analysis sharp, no pleural effusion. Yeah, sounds good. I might actually take that bit out and accept the report there.